Check 1 2 check 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 2 1 check 1 2 3 4 5 6 7 8 9 10 check 1 2 check 2 check 2 check 2 check 1 2.
Yes, I told them they were waiting for sound check form.
Dr. Njoo, how are you?
I'm very good, thank you.
Thanks for joining us. Do you have your camera on?
I do now. Hopefully,
Thank
I have.
you.
I guess I better take my blurry setting off. Hold on. There's too many. How do I? Quite sure. This. It's a different setting in terms of. Unless you don't mind, I don't know what the blurry setting. Hold on. I'm trying to.
You're fine. That's fine, Dr. Njoo. Not
Oh,
yet.
here it is. Okay, got it. Just so many different times we do these things. There you go. Is that good?
Thank you, Doctor. You're speaking third after Dr. Russell. Dr. Njoo.
That's right. That's my understanding. After Dr. Russell. Okay, yeah.
Thank you. We're going to start inviting the members of the media in, and we're going to start on time.
Like being away from it's awkward being back here.
Doctors. Bon après-midi, tout le monde. Good afternoon, everyone, and welcome to today's news conference regarding the final report stemming from an investigation into a potential neurological syndrome of unknown cause. Bienvenue à cette conférence de presse, un rapport final découlant une enquête sur le possible syndrome neurologique de cause inconnue. Speaking this afternoon in the following order are my apologies. Okay. Merci beaucoup tout le monde pour votre patience. Thank you for your patience. Good afternoon, everyone, and welcome to today's news conference regarding the final report from an investigation into a potential neurological syndrome of unknown cause. Bonjour tout le monde et bienvenue à cette conférence de presse sur un rapport final découlant d'enquête sur un possible syndrome neurologique de cause inconnue. Speaking this afternoon in the following order are Dr. Natalie Banville, Vice President of Medical Affairs at Vitalité Health Network. Dr. Jennifer Russell, the province's Chief Medical Officer of Health. Dr. Howard Njoo, Deputy Chief Public Health Officer, Public Health Agency of Canada. Dr. Susan Brien, Vice President of Medical, Academic and Research Affairs for Horizon Health Network, and the Honorable Dorothy Shephard, Minister of Health. Les porte-paroles aujourd'hui dans l'ordre suivant sont Dr. Natalie Banville, vice-présidente en affaires médicales réseau de santé Vitalité, la médecin hygiéniste en chef, le Dr. Jennifer Russell, le sous-administrateur en chef de la santé publique à l'Agence de la santé publique du Canada, le Dr. Howard Njoo, Dr. Susan Brien, vice-présidente aux affaires médicales, université et de la recherche, réseau de santé Horizon, et l'honorable Dorothy Shephard, ministre de la Santé. Dr. Banville.
Madame la ministre, Dr. Russell, collègues, mesdames et messieurs, bonjour. Au nom de ma coprésidente du comité de surveillance du syndrome neurologique de cause inconnue, Dr. Susan Brien, et de tous les membres du comité, je suis ici pour vous présenter les résultats de notre travail. D'ailleurs, je tiens à souligner le travail méticuleux et acharné des membres de ce comité qui a accepté ce mandat pour éclairer des questions importantes en lien avec l'enquête sur le syndrome neurologique de cause inconnue. Comme vous le savez, le comité était composé de 6 neurologues indépendants qui exercent tous dans la province et qui possèdent diverses expertises dans le domaine de la neurologie, de 2 coprésidentes des réseaux de santé, Horizon et Vitalité, et finalement d'un médecin hygiéniste qui agissait à titre d'agent de liaison avec la santé publique du Nouveau-Brunswick. Dans le cadre de cette enquête menée par la santé publique du Nouveau-Brunswick, nous avons reçu le mandat d'assurer une surveillance et formuler des recommandations d'experts indépendants à propos de questions précises. Nous devions déterminer ou non la présence d'un syndrome neurologique potentiel de cause inconnue en examinant 48 cas associés à une grappe où les patients avaient certains signes et symptômes communs et absence de diagnostic confirmé. Le rôle des neurologues au sein de ce comité était d'effectuer un examen par les pairs et d'assurer une surveillance experte des cas signalés et une diligence raisonnable, mais aussi d'aider à déterminer la probabilité de d'autres diagnostics possibles où une enquête plus approfondie serait indiquée. Ce travail a notamment consisté à un examen complet des renseignements et des dossiers diagnostiques et cliniques de chaque cas signalé, comme on le fait habituellement dans une surveillance par les pairs. Dès le départ, le comité a établi un protocole rigoureux et éthique permettant de procéder à l'examen dans le respect du droit à la vie privée de la personne concernée et en réduisant le risque de partialité. Entre août 2020 et février 2022, le comité a effectué l'examen de 48 personnes identifiées comme membres de la grappe. Dans le cadre des examens cliniques approfondis, les cas ont été attribués de manière aléatoire à une paire de neurologues qui les ont examinés de façon indépendante. Ensuite, les 2 neurologues se sont rencontrés pour discuter de leurs résultats et les comparer. Finalement, ils ont présenté leurs résultats et en ont discuté avec le comité plénier. L'historique complet des données et antécédents du patient ont été réunis, notamment des renseignements démographiques, les mots exprimés, les antécédents médicaux, sociaux et familiaux, les traitements et les suivis, les examens suivis et les enquêtes, y compris les tests de laboratoire et les résultats d'imagerie diagnostique. Des renseignements détaillés ont été réunis dans chaque catégorie afin de décrire les caractéristiques des symptômes et des signes, leur progression ou leur résolution, les thérapies et les traitements en cours. Dans le rapport que vous avez en main, vous trouverez également les commentaires et des recommandations des examinateurs concernant la nécessité d'un nouvel examen ou d'autres tests. En somme, après avoir effectué l'examen des dossiers, les neurologues ont offert des diagnostics alternatifs chez 41 patients, soit 85 de la cohorte. Les diagnostics alternatifs incluent divers problèmes de santé connus comme la maladie d'Alzheimer, la démence à corps de Louis, la démence mixte, la polyneuropathie diabétique ou inflammatoire, des démences induites par la maladie de Parkinson, des démences frontotemporales, le syndrome post-commotionnel, des syndromes de fatigue chronique, des troubles anxieux chroniques graves, le cancer. À la lumière de ces constatations, le comité a conclu que, bien que certains des sujets présentent des symptômes inhabituels, ils ne sont pas atteints d'une maladie commune d'étiologie inconnue. Il n'y a aucune preuve de l'existence d'une grappe de personnes atteintes d'un syndrome neurologique de cause inconnue. Le comité a constaté que sur 48 sujets, aucun ne rencontrait tous les critères de définition d'un cas. En plus de ces conclusions, sur les examens de cas, le comité souhaite formuler des recommandations suivantes pour les prochaines étapes. D'abord, des recommandations en lien avec le processus. L'examen n'a pas été en mesure de conclure que le neurologue référent avait demandé un deuxième avis avant de référer des personnes au groupe de cas suspects d'une maladie neurologique inconnue, avec la présence de symptômes qui ne correspondaient pas à un tableau clinique reconnaissable. Par conséquent, le comité recommande que tout cas futur soupçonné d'atteinte d'un nouveau syndrome ou d'une nouvelle maladie soit examiné par un deuxième spécialiste, par exemple, dans ce cas, un neurologue ou un gériatre. En deuxième, compte tenu des difficultés rencontrées pour accéder aux renseignements pertinents sur les patients, ce qui a entraîné des retards inutiles dans l'examen des cas, le comité recommande que des protocoles écrits soient mis en place pour l'échange de dossiers individuels avec la santé publique du Nouveau-Brunswick aux fins d'enquête futures. Nous proposons également 3 recommandations en lien avec les patients. Des communications avec les médecins fournisseurs de soins primaires de ces patients pour les informer des constatations du comité de surveillance et des recommandations des neurologues en vue de tests plus poussés ou d'une réévaluation. Il est à noter que le comité croit comprendre que ces personnes ont continué de recevoir des soins par l'intermédiaire de leurs fournisseurs de soins primaires, de la clinique interdisciplinaire des maladies neurodégénératives de Moncton ou d'autres fournisseurs de soins spécialisés pendant que l'enquête est en cours. De nombreux patients et membres de leur famille auront des questions au sujet de leur état. Tous les patients visés par cette enquête devraient recevoir leur accès à des soins continus sous la supervision d'un spécialiste. Finalement, le comité recommande que la clinique interdisciplinaire des maladies neurodégénératives de Moncton continue d'offrir un soutien continu aux personnes qui ont été désignées comme faisant partie de la grappe et à d'autres citoyens du Nouveau-Brunswick. Cette clinique spécialisée a été créée pour l'investigation et le traitement des maladies neurodégénératives. De plus, j'aimerais vous informer qu'il y a d'autres ressources disponibles pour les patients, notamment la clinique des troubles de la mémoire atypique ou précoce et de la recherche en neurodégénérescence. Elle est située au CHU-du-Mont, dans le département de neurologie. En terminant, je tiens à souligner que les membres du comité reconnaissent que les patients qui étaient originalement inclus dans cette grappe sont affligés de problèmes de santé graves qui ont une incidence profonde sur leur vie. Les maladies neurodégénératives sont très complexes et parfois très longues à diagnostiquer et à comprendre. Nous reconnaissons également que malgré les clarifications apportées par ce rapport et le rejet de spéculations à propos d'un syndrome neurologique de cause potentiellement inconnue, la souffrance des patients n'en demeure pas moins réelle. Le travail d'investigation, de suivi et de soutien doit donc continuer. Nous souhaitons donc en toute sincérité que des procédures mieux définies gouvernent à l'avenir le processus diagnostique afin que soit évitée toute souffrance accrue chez les patients concernés. Je vous remercie.
Merci, Dr. Banville. Et je veux aussi remercier Dr. Brien ici, pour être ici aujourd'hui, déplacés de leur place à emploi. I just wanted to thank Dr. Banville and Dr. Brien for being here today. I know they had to travel to make this possible. Good afternoon, everyone. Bonjour. Avant de vous faire part des conclusions de cette enquête sur une éclosion, je tiens à souligner les 48 personnes qui en sont au cœur. Cette expérience a été extrêmement stressante, non seulement pour celles-ci, mais aussi pour les proches qui les ont soutenues pendant cette épreuve. Before I share the conclusions of this outbreak investigation, I want to recognize the 48 people at the heart of this. This experience has been extremely stressful, not only for them, but for their friends and family who have supported them throughout this ordeal. I hope by now they have all had the same opportunity to discuss their cases with their primary care providers and to decide on a path forward for treatment and care. Today, we are bringing to a close a two-pronged public health investigation. New Brunswick's Epidemiology and Surveillance Branch conducted extensive interviews with people in the cluster last summer. It concluded in October there were no shared behaviors, foods, or environmental exposures that could be a risk factor for the syndrome. In other words, New Brunswickers should feel confident that nothing in the environment is making them sick. Comme l'a dit le Dr. Banville, le comité de surveillance a convenu à l'unanimité que ces 48 personnes n'auraient pas dû être identifiées comme ayant un syndrome neurologique de cause inconnue et que, d'après les données probantes examinées, il n'existe pas de syndrome de ce type. Santé publique souscrit à ces conclusions. As you have heard from Dr. Banville, the Oversight Committee has unanimously agreed that these 48 people should never have been identified as having a neurological syndrome of unknown cause, and that based on the evidence reviewed, no such syndrome exists. Public health concurs with these findings. But I stress again, this does not mean that these people aren't seriously ill. It means they are ill with a known neurological condition. This can include in conditions such as Alzheimer's disease, Lewy body dementia, diabetic or inflammatory polyneuropathy, Parkinson's disease, post-concussion syndrome, or cancer. So where did this start and how did we get here? The possibility of a potential cluster emerged during ongoing meetings discussing routine monitoring of CJD in New Brunswick. CJD, or Creutzfeldt-Jakob disease, is a rare, fatal degenerative brain disorder caused by an infectious protein or prion. The Public Health Agency of Canada has a CJD surveillance system to track cases across the country. Individual physicians send patient referrals to the CJD-SS. In return, they provide laboratory testing, experts for consultations, clinical coordination, and support for investigations. In early 2020, there was an unusual increase in the number of New Brunswick patients being referred to CJD-SS. Tous les cas, sauf 2, avaient été aiguillés par le même médecin traitant. Santé publique Nouveau-Brunswick n'a pas été informée de cette situation avant une réunion de septembre 2020, lors de laquelle les représentants de l'Agence de la santé publique du Canada ont décrit un certain nombre de cas du Nouveau-Brunswick présentant des symptômes s'apparentant à ceux de la maladie de Creutzfeldt-Jakob, mais dont les analyses ne révélaient pas une maladie humaine à prion. All but 2 of these cases had come from a single referring physician. Public Health New Brunswick was not notified this was occurring until a meeting in September of that year, where officials from the Public Health Agency of Canada described a number of New Brunswick cases with CJD-like symptoms, but testing negative for human prion diseases. A conversation began between CJD-SS, Public Health New Brunswick, and the main referring physician about whether these individuals were part of a potential cluster or group of cases with a known syndrome of unknown cause. With a neurological syndrome of unknown cause. A draft case definition was provided a few weeks later, and Public Health New Brunswick accepted this case definition. This was when Public Health New Brunswick launched its outbreak investigation. Bien que cela puisse sembler inquiétant, les enquêtes sur les éclosions font partie intégrante du travail de santé publique. Il n'est pas rare de ne pas connaître la cause ni la source d'une maladie avant que l'enquête ne soit terminée. Although it may sound alarming, an outbreak investigation is an ordinary part of public health work. We don't often know the cause or source of an illness until the investigation is complete. Investigating clusters, disease outbreaks, or other threats is part of public health's mandate to protect the health of New Brunswickers. And a mystery illness is only a mystery until it's solved. When disease outbreaks or other public health threats emerge, public health teams investigate. They identify the cause, they quickly implement control measures, and collect evidence to recommend ways to stop the spread. The Centre for Disease Control refers to these teams as disease detectives. Depending on the findings during an investigation, investigators may explore different areas. In this case, Public Health New Brunswick met with multiple experts to try to answer basic questions such as, who is sick? What are their symptoms? Is there any pattern in symptoms among the sick people? Is the sickness related to any exposure to a particular substance or environmental factor? Where could they have been exposed? La maladie est-elle liée à l'exposition à une substance particulière ou à un facteur environnemental? Où ont-elles pu être exposées? These questions were used to develop the Enhanced Epidemiological Surveillance Questionnaire. Many experts were involved in the development of this survey, and the questionnaire was extremely detailed but could find no common exposures in the group. You can find both the 74-page questionnaire and the results of that survey on our webpage. Au cours de l'enquête, Santé publique a pris connaissance de nombreuses théories non fondées et opinions non corroborées qui ont été amplifiées dans les médias. Certaines rumeurs laissent croire que les analyses de sol, de l'eau et des facteurs environnementaux étaient problématiques. Over the course of this investigation, public health became aware of many unfounded theories and uncorroborated opinions being amplified in the media. Some of these rumors suggested that soil, water, and environmental testing was suspected. That is untrue. It would be a direct violation of public health's mandate. My apologies. It would be a direct violation of public health's mandate to not protect the health and safety of New Brunswickers and a breach of public trust. We have posted links on our webpage to ongoing municipal, provincial, and federal collaborations to ensure safe drinking water for the monitoring of environmental toxins and contaminants and the safe harvesting of fish, lobster, and shellfish. Particular attention was paid to cyanobacteria toxins produced by blue-green algae, as this is a known risk to public health. No link was found. You can find more information about blue-green algae monitoring in the frequently asked questions section of our webpage or at the Public Health Advisories and Alerts page on the GNB website. My apologies. Okay, that's better. Some of these changes we can make ourselves. Others are regulatory changes that require government support or action at the federal, provincial, or territorial level. In our final report, Public Health New Brunswick has made several recommendations to ensure that a situation such as this one does not occur again. Some of these changes we can make ourselves. Others are regulatory changes that require government support or action at the federal, provincial, territorial level. À l'avenir, Santé publique Nouveau-Brunswick pourrait demander un examen clinique des cas par un deuxième médecin spécialiste avant de les inclure dans une grappe de cas dont l'étiologie est inconnue. Si les deux médecins ne s'entendent pas, le cas devrait être présenté à un conseil de médecins spécialistes ou à un comité de surveillance aux fins de décision. Nous recommandons que le règlement sur certaines maladies et le protocole de signalement pris en vertu de la loi sur la santé publique soit modifié pour rendre obligatoire la déclaration à santé publique de tout cas suspect de toute variante existante ou nouvelle de maladie à prion humaine ou animale. Santé publique Nouveau-Brunswick devrait continuer à tirer parti des collaborations avec l'Agence de la santé publique du Canada et d'autres partenaires fédéraux et provinciaux pour améliorer et moderniser le système national de surveillance de la maladie Creutzfeldt-Jakob et pour établir ou améliorer les processus liés aux enquêtes sur les éclosions, y compris celles où la maladie à prion a été exclue. À cette fin, nous appuyons la formation d'un groupe de travail fédéral, provincial et territorial qui contribuerait à cet examen. In the future, Public Health New Brunswick may request a clinical review of cases by a second specialist physician prior to including cases in a cluster of unknown etiology. If the two physicians do not agree, the case should be presented to a board of specialty doctors or an oversight committee for a decision. We are recommending that the Reporting and Diseases Regulation under the Public Health Act be amended to require a suspect case of any existing or new variant of human or animal prion disease be reported to Public Health. Public Health New Brunswick should continue to build on collaborations with Public Health Agency of Canada and other federal and provincial partners to improve and modernize the national CJD surveillance system and to establish or improve processes related to outbreak investigations, including those where prion disease has been excluded. To this end, we support the creation of federal, provincial, and territorial working group that would support this review. Before I conclude, there are many individuals whose efforts should be recognized. Thank you to the public health nurses who conducted the enhanced surveillance interviews. Their work was integral to this process. I would like to thank those collaborators from across the country who responded to our call to action and came together as a multidisciplinary team of experts. They helped Public Health New Brunswick discern plausible hypotheses, build investigation tools, and inform the course of our investigation. Thank you to our partners, the Public Health Agency of Canada, for our continued collaboration to modernize and improve the processes for supporting the health and well-being of our citizens. I am very grateful to the members of the Oversight Committee who gave tirelessly of their considerable expertise despite carrying large and challenging caseloads during their normal functions. We are also grateful to the Mind Clinic, which is providing coordinated care and support to affected individuals and their families. Enfin et surtout, je tiens à remercier les participants à cette enquête et les membres de leurs familles. J'espère sincèrement que les conclusions de l'enquête éclairciront la situation et les aideront dans leur cheminement. Lastly, and most importantly, to the individuals who were part of this investigation and their families, I thank you for your participation and sincerely hope that the findings of this investigation will provide you with a clearer path as you move forward. Thank you, merci beaucoup, and I will now turn it over to my colleague at Public Health Agency of Canada, Dr. Howard Njoo.
Okay, Dr.
merci.
Russell, et bonjour à tous et à toutes. Good afternoon, everyone. My name is Dr. Howard Njoo, and I'm the Deputy Chief Public Health Officer at the Public Health Agency of Canada. I would like to acknowledge that the land on which I'm calling in from is the traditional unceded territory of the Algonquin Anishinaabe people. First of all, I would like to say that collectively, our thoughts are with the patients and the families of those involved. We understand the impacts that this investigation has had on each and every one of you. Protecting the health of Canadians is of the utmost importance to the Government of Canada. The Government of New Brunswick led the investigation into a cluster of cases of atypical neurological syndrome. Throughout the investigation, the Public Health Agency of Canada has been collaborating with the province. Over the course of the investigation, the Public Health Agency of Canada provided specialized diagnostic laboratory and neuropathology services and expertise to rule out prion disease. And through the Canadian Field Epidemiology Program, we deployed several epidemiologists and assisted in the development of the epidemiological questionnaire. Our Canadian Creutzfeldt-Jakob disease surveillance system helped rule out Creutzfeldt-Jakob disease. This long-standing federal program conducts national surveillance for all types of human prion disease in Canada. All human prion diseases are provincially reportable and nationally notifiable in Canada. The Public Health Agency of Canada is pleased that the investigation has come to a close and supports the investigation's findings that this cluster does not represent a neurological syndrome of unknown cause. The Public Health Agency of Canada welcomes the recommendations from the Government of New Brunswick. We will continue to work closely with the provinces and territories, partners and stakeholders to monitor and understand the risks to human health from neurological diseases, and will build on any lessons learned during this investigation. The Public Health Agency of Canada will also continue to build on collaborations with Public Health New Brunswick and other federal and provincial partners to enhance and modernize the Canadian Creutzfeldt-Jakob disease surveillance system. To this end, we support the creation of a federal, provincial, and territorial working group for this purpose. Thank you. Je me présente, Dr. Howard Njoo, sous-administrateur en chef de la santé publique à l'Agence de la santé publique du Canada. Je tiens à souligner que le territoire à partir duquel j'effectue cet appel est le territoire traditionnel et non cédé de la nation algonquine Anishinaabe. Premièrement, j'aimerais dire que nos pensées sont aux patients et aux familles des personnes touchées. Nous comprenons les répercussions que cette enquête a eues sur chacun et chacune d'entre vous. Pour le gouvernement du Canada, la protection de la santé des Canadiens est d'une importance capitale. Le gouvernement de Nouveau-Brunswick a mené l'enquête sur une grappe de cas d'un syndrome neurologique atypique. Tout au long de l'enquête, l'Agence de la santé publique du Canada a collaboré avec la province. Au cours de l'enquête, l'Agence de la santé publique du Canada a offert une expertise et des services spécialisés d'analyse diagnostique de neuropathologie pour écarter la maladie à Brien. Par l'intermédiaire du programme canadien d'épidémiologie de terrain, nous avons déployé plusieurs épidémiologistes à aider à l'élaboration des questionnaires épidémiologiques. Grâce à notre système canadien de surveillance de la maladie de Creutzfeldt-Jakob, nous avons pu écarter la maladie de Creutzfeldt-Jakob. Ce programme fédéral de longue date assure une surveillance à l'échelle nationale de tous les types de maladies à prions humaines au Canada. Tous les cas de maladies à prions humaines doivent être déclarés à l'échelle provinciale et à l'échelle nationale au Canada. L'Agence de la santé publique du Canada se réjouit de la conclusion de l'enquête et en appuie les conclusions selon lesquelles cette grappe de cas ne représente pas un syndrome neurologique de cause inconnue. L'Agence de la santé publique du Canada accueille favorablement les recommandations du gouvernement de Nouveau-Brunswick. Nous continuerons de collaborer étroitement avec les provinces et les territoires, nos partenaires, les intervenants pour surveiller et comprendre les risques pour la santé humaine résultant des maladies neurologiques. Nous mettrons à profit les leçons apprises pendant cette enquête. L'Agence de la santé publique du Canada continuera également de miser sur la collaboration avec la santé publique de Nouveau-Brunswick et ses autres partenaires fédéraux et provinciaux en vue d'améliorer et de moderniser le système canadien de surveillance de la maladie de Creutzfeldt-Jakob. À cette fin, nous appuyons la mise sur pied d'un groupe de travail fédéral, provincial et territorial chargé de ce dossier. Merci.
Good afternoon, bonjour. As Horizon's Vice President of Medical, Academic, and Research Affairs, I oversee Horizon's Moncton Interdisciplinary Neurodegenerative Diseases Clinic, known as the Mind Clinic, and I was the co-chair of Public Health New Brunswick's Oversight Committee to support this investigation. I want to acknowledge the patients and families who have been anxiously waiting for the results of this report, the answers to their questions, and the next steps. I would also like to take a moment to thank all of the clinicians and experts who care for these patients. Your work is very appreciated. I would like to explain the role of the Mind Clinic has played in this situation and the important role it will continue to play in the healthcare system in New Brunswick going forward. The Mind Clinic, located in Horizons the Moncton Hospital, is a tertiary care service that has provided care and services to the patients identified as part of the cluster investigated by New Brunswick Public Health. The patients were referred to the specialty clinic by physicians across the province for their diagnosis and care based on their progressive neurodegenerative symptoms. It requires the expertise of a team made of several specialists in the field of neurodegenerative diseases. The Mind Clinic is continuing to provide ongoing testing, assessment, and care and treatment to patients who do not have a diagnosis, as well to assist their families in assessing and accessing community resources. The patients were asked to follow up with their primary care provider following the letter from the Oversight Committee, and they will continue to have access to specialists at the Mind Clinic. The clinical care and expertise that our Mind Clinic team provides will continue to focus on each patient and their families and their individual needs. The Mind Clinic's mission extends beyond the assessment and care of these 48 patients. The Mind Clinic is a cross-specialty collaborative clinic for all adult progressive neurodegenerative diseases. This clinic's goal is to assess and diagnose and provide ongoing support and improve the quality of life of patients and their families. The Mind Clinic now has a dedicated team of many professionals, including geriatricians, neurologists, registered nurses, neuropsychologist, social worker, and research manager. Also, associates of psychiatry and neurology also support the team. Neurodegenerative disease is a term for a range of conditions affecting the nerve cells in the brain that can cause problems with mental functioning and/or movement disorders. Progressive means that the onset of symptoms is faster than typical cases. Since April 2021, when the clinic was established, the clinic has had over 200 patients from all over New Brunswick referred to them. The great work that this team is doing will continue to be needed well in the future. Horizon is prepared to expand the multi-specialty clinic to be able to provide care for even more patients throughout New Brunswick with neurodegenerative diseases. The Mind Clinic will also be collaborating with others to conduct important research with provincial and national experts to improve our understanding of neurodegenerative diseases, and will study how we can identify and treat those conditions. We understand that in other jurisdictions that this coordinated care model could even reduce the number of emergency department visits, hospitalizations, and long-term care admissions. Thank you to the Mind Clinic team leaders who play a valuable role in our health system. To the patients and families, we know this has been a difficult time. We appreciate your patience, your engagement, and will continue to work hard to provide the best care for all. Thank you. Merci.
Good afternoon. Bonjour. Yesterday, I received Public Health's final report into its investigation of a potential neurological syndrome of unknown cause. Public Health New Brunswick report accepts the findings of an oversight committee that independently reviewed all 48 potential cases. The committee has concluded that no such syndrome exists. Le comité a conclu que tel syndrome n'existe pas. Public Health has also made several recommendations to improve the way potential new diseases are reported and investigated. I want to thank Public Health New Brunswick for their thorough work in this investigation, which was conducted in the midst of a global pandemic. I am also grateful to the Oversight Committee for undertaking an enormous task when they have no shortage of work. Thank you for your commitment to providing quality care to New Brunswickers. Je vous remercie de votre engagement à fournir des soins de qualité aux jeunes de Nouveau-Brunswick. Earlier this morning, I participated in a briefing with the patients and families who were previously told that they or their loved one had a neurological syndrome of unknown cause. We can finally say today that this is not the case. This entire process has been extremely trying for these families, and this news was difficult for them to hear. Throughout this time, they have been desperately seeking answers and hoping for a cure. It's heartbreaking to have to tell them the syndrome did not exist. I recognize that the process we put into place was frustrating for them. Je suis consciente de la frustration engendrée par les démarches. As part of the epidemiological investigation, Public Health conducted 34 interviews, asking 74 questions each. That represents weeks and weeks of work. Public health investigations take time and are completely confidential to uphold patient privacy. We are unable to talk about the findings until the data was fully compiled and the report complete. The Oversight Committee had to review the records of each patient. Each review was specific to a particular patient and subject to doctor-patient confidentiality. We had to allow this work to run its course in order to provide you with the information we are sharing today. The families have asked us for respect and dignity. Les familles nous ont demandé de faire preuve de respect et de dignité. It was important that each patient receive the committee's recommendations about their specific case from their primary care provider before the results of the committee's work was shared publicly. The focus now must turn to providing these individuals with the follow-up assessment and care that they need for what are most certainly serious illnesses. I am confident that our province's physicians are fully capable of providing that care, but I advise the patients and their families today that they are welcome to seek a second opinion outside the province if they wish. We also need to take steps to ensure that this doesn't happen again. The stress and anxiety that these families have experienced should not have occurred. I am accepting Public Health's recommendations that the reporting and disease regulation under the Public Health Act be amended and will bring that to government for its consideration. We are also recommending the creation of a federal, provincial, and territorial working group to review and modernize processes related to CJD surveillance and any subsequent outbreak investigations that may occur from this surveillance. If any good has come of this, it is that we now have the multidisciplinary clinic dedicated to neurodegenerative conditions. And although this was initially established to support the 48 people in the cluster, it has now seen more than 200 patients from across the province. The need for comprehensive and multidisciplinary care was there. Il y avait un réel besoin pour des soins multidisciplinaires. The Mind Clinic has expanded to include a team made up of geriatricians, neurologists, registered nurses, a social worker, and now a research manager with knowledgeable research experience. I know that there are other patients out there who have wondered if they might be suffering from this potential syndrome. Others were told that they had this potential syndrome, but were not part of the files that were provided to Public Health. If you have not been contacted by Public Health at this point, your file was not provided to Public Health. However, the Mind Clinic can serve your needs capably as well, and I encourage you to contact your primary care providers to get a referral. Every day, New Brunswickers receive very difficult news about their health from healthcare providers who are committed to providing them with the best possible care. Public Health is hard at work in our communities, investigating disease, preventing illness, and promoting population health. All of this work is done in the best interests of the people of this province. The healthcare system exists to serve all New Brunswickers. It will continue to serve New Brunswickers, including these 48 families, patients and their families, to the very best of its ability. Thank you. Merci.
Thank you, Minister and doctors. Merci beaucoup, Minister Shephard et les docteurs. We'll now proceed to questions from members of the media. Each reporter will have one question. You have the right to pose your question in the language of your choice. Please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser votre question dans la langue de votre choix. Chaque journaliste aura une question. Voulez-vous assurer de désactiver le son de vos micros? Laura Brown, CTV.
Hi there. I have a question that's similar to the one that I had in my technical briefing. There are a group of them that you guys have identified in the report that you say have 4 clinical features that match the case definition, but not completely. Can you explain that a bit more? So are those people part of the group that you feel need further investigation?
Hi, Laura. During the technical briefing, Dr. Banville did explain that none of the patients met the case definition. And with respect to any of the symptoms of any of the individuals that need ongoing support, whether it be further diagnostic tests, referrals, et cetera, they can get that support and that treatment at the Mind Clinic and those assessments. And as Minister Shephard mentioned, that if somebody wanted a second opinion outside of the province, they are welcome to do that. And if Dr. Banville has anything to add, I'll...
Thank you. Merci beaucoup. Thank you. Nicolas Steinbach, Radio-Canada. Mr. Steinbach. We're going to go and proceed to Angela Gilbert with CBC. Kayla Hounsell, CBC. Carissa Duncan, CBC. Vas-y, Nico.
Oui. Oh, sorry. OK, c'est bon. Merci beaucoup. Je voudrais savoir quel est le statut d'emploi du docteur Alière Marrero aujourd'hui et s'il y aura une suite concernant son avenir dans les prochains jours, prochaines semaines.
Le rapport vient tout juste d'être déposé. Les équipes responsables vont analyser. Présentement, notre priorité, c'est revient aux patients. On a des processus en place qui ne relèvent pas de la vice-présidence aux affaires médicales. Donc, les gens concernés vont regarder le dossier, regarder le rapport et prendre la décision s'il y a des mesures à entreprendre.
Thank you. Carissa Duncan, CBC.
Thanks, Bruce. My question is for Dr. Russell. Dr. Russell, I just want to talk a little bit about the memo that was sent out last March to the healthcare providers in the province, and this provided the case definition, which the report now says was vague and overly broad. Do you believe that public health in New Brunswick did its due diligence before raising the red flag, particularly when it comes to perhaps detecting that the case definition was vague and overly broad? And if not, why not?
Hi, Carissa. So basically, the process for any investigation is quite similar, and in terms of establishing a case definition. And when the Oversight Committee was established, it was within their mandate to change that case definition if they saw fit, but they did not see that being necessary.
Thank you. Kevin Bissett, Canadian Press. Catherine Allard, Radio-Canada. Vicky Hogarth, CHCO.
Thank you, Bruce. I should just let the other reporters know they probably need to press *6 to unmute themselves. My question is for Minister Shephard and/or Dr. Russell. In early January, The Guardian published an article which included an interview with an unnamed whistleblower from Vitalité. The article claimed that caregivers of some of the cases under investigation developed symptoms similar to the cases, suggesting environmental factors might be a factor. How do you respond to this claim?
Thank you for the question, Vicki. I can only say that the Mind Clinic is there for any referrals that can be looked at, and I'm not aware of any more than one additional report to Public Health Agency of Canada, which is under investigation. But there is not a numerous number of cases that have been put forward, so I'm not sure I cannot validate that question.
Hi, Vicki. The good news story coming out of today, despite the challenges and grief and anxiety that people have experienced, is that we've identified a way forward with respect to a process that makes sure that nobody falls through the cracks and that makes sure that everybody who needs care and investigation and treatment will get that, whether it's at the Mind Clinic or with respect to anything that looks unusual or new, having the process and the recommendations for changes to the Public Health Act, et cetera, in terms of reporting, and making sure that there are two physicians who corroborate any new or different outbreak investigation in terms of referrals. So having highlighted all of these new processes, again, our work with Public Health Agency of Canada to ensure that moving forward we have a very rigorous process in place, we can really ensure that we ensure that people who require treatment and investigation will get that. Again, either at the Mind Clinic, and as Minister Shephard alluded to, that if they wanted a second opinion outside of the province, they could do that.
Thank you. Suzanne Lapointe, Global TV.
Hi there. I'm just wondering, if you've determined that this disease doesn't exist, why have you made the decision to expand the Mind Clinic?
I think I can answer that, but if Dr. Brien needs to jump in, she can. We absolutely know that this multidisciplinary team is a very good approach to helping patients with neurological illnesses, and so especially degenerative. And so that's where this clinic is going to focus. And we know that it can't be anything but good. And so we've resolved, and Horizon has resolved, to ensure that it continues.
Thank you.
Thank you.
Louis-Philippe Morin avec CHAU-TVA. Sarah Seeley, Brunswick News.
Question is about all of those patients or New Brunswickers who might be kind of skeptical still about how things were handled or how things are going to be happening going forward. And I was just wondering what you have to say about kind of your reaction to the skepticism.
it's unfortunate, but I can understand it. So we have been very methodical, very thorough. Public health has been very methodical and very thorough with this approach. It is scientific. It has been standard practice, best practice, and so I have to have some confidence in the experts that have put themselves out and come and stepped up to help with this, and it's for public review and expertise review. So you know, I have to have confidence that they've done their work.
Thank you. Simon Delatte, Acadie Nouvelle.
Oui, j'aimerais savoir quelles leçons vous voudriez tirer de cette affaire. S'il fallait repartir à zéro, qu'est-ce que vous feriez différemment, notamment sur la façon dont tout ça a été communiqué?
Alors, je crois qu'il y a beaucoup de leçons qu'on a apprises durant ce processus, mais la chose qui est le plus positive, c'est qu'on a trouvé une façon d'améliorer les processus en collaboration avec l'Agence de santé publique du Canada et aussi avec le Mind Clinic aussi, et aussi pour les référals au futur, pour faire certaine qu'on ne va pas répéter une situation comme celle-ci.
Merci. Tara Clow. 91.9 The Bend. Océane Doucette, Radio-Canada. Erica Butler, CHMA. Greg Mercer, Globe and Mail. Dan Hurley, Neurology Today. Rachel Huizinga, allnewbrunswick.com.
Hi, I'm actually reporting for CBC New Brunswick. My question is for Dr. Russell. Almost exactly a year ago, you said this is most likely a new disease. Now you're saying there is no new disease. How can the public trust this conclusion you've come to today, given that the province's Chief Medical Officer of Health was wrong about that only a year ago?
Well, we have so much more information today compared to what we had a year ago, and that's because of the entire team's work at Public Health, but also with the Oversight Committee. So having gone through all of the cases with the case definition, with the neurologists who were on the Oversight Committee, I think they spent at least 2 hours per case file, 2 to 4 hours per, or longer actually. So to have that many specialists involved, our epidemiologist team and our work with Public Health Agency of Canada, I certainly am not infallible in terms of coming to the hypotheses that I did a year ago. So, but having all of this new information and the conclusions and rigor, along with the multidisciplinary involvement of other departments like DAF and ELG, et cetera, I'm much more confident today because of that contribution to the new information that we have now that we are able to give at this time. And at the end of the day, the most important thing are the patients and their families, and making sure that they get the correct diagnosis and treatment and support that is available at the Mind Clinic currently. And as I can reiterate what Minister Shephard said, that if members of that group wish to have a second opinion outside of the province, they are welcome to.
Steve McKinley, Toronto Star. Amanda Coletta with the Washington Post. Angela Gilbert with CBC.
Can you hear me?
Yes, go ahead.
Hello?
Yes.
Can you hear me okay?
Yes.
Hi. My question is of the members of the cluster. I know Dr. Marrero, one of his main concerns, and I think what initially sort of set him down this course, was that many of the patients that he was seeing, that he couldn't figure out what was going on, they were very young. And we've never had a complete breakdown of the ages. And particularly now that we see that, I think the majority of them, 29, I believe it was, have rapid onset dementia as their possible diagnoses. I'm just wondering if the province would provide a breakdown of the ages for those individuals.
Page 13 of Oversight Committee report has a breakdown.
I'm sorry to be so long getting to you here. I'm sorry, you said page 13 has the 12. So the report is online now, but we will give you the patient, the median age was 57, a range of 18 to 85. Age 40 or younger, there were 10, equaling 21%. And I think that's all I have with an age breakdown. So 48 patients, 57 was the median age from between the range of 18 to 85, and 10 were under 40.
Thank you. Kayla Hounsel.
Hey there, Kayla was having some issues with her microphone, but I can ask her question if you're okay with that.
I can gonna go proceed to Tara Clow right now. If time permits, I'll cycle back. Tara Clow with the 91.9 The Bend. Kevin Bissett, Canadian Press. His question is, the families of the cluster patients have reported hearing of many other patients who have presented to the Mind Clinic with similar symptoms. Do you have numbers, and will those beyond the 48 now get second opinions?
So public health has not been made aware of any additions to this cluster through the Mind Clinic. I think I'm accurate in saying that. And so if there is a primary care provider referring, the Mind Clinic would make a judgment from there. I'm going to let Dr. Russell add to this.
Yeah, certainly with the new process in place, we will accept those referrals in terms of when they're identified, the process that is established right now. So, but we haven't received, if we have received, it would only be we've only received one. But again, we would be happy to receive those, and we just have to be notified.
Catherine Allard, Radio-Canada. Louis-Philippe Morin, CHAU-TV. Greg Mercer, Globe and Mail. Erica Butler, CHMA. Steve McKinley, Toronto Star. Océane Doucette, Radio-Canada. Dan Hurley, Neurology Today.
Well, do they have to press star 6? That's what Vicky said. Is that the problem? That's what Vicky said. Is that the problem?
Suzanne Lapointe, Global TV.
I've already asked my question. I'm good.
Okay. Maybe we can offer to have them in writing.
Ladies and gentlemen, I'm unfortunate that we are running out of time. We have run out of time. Voilà la fin de notre mise à jour. For those that couldn't log in, I suggest that you send us your questions through email, and we will have to get back to you that way. Merci beaucoup.